Now, the high cholesterol, even though it is implicated in coronary artery disease, cerebral means in the brain, blockage in the brain, there are people who have high cholesterol and don't have heart disease. So high cholesterol is one of the factors that is involved in coronary artery disease. Not the only one, not the major one, many other factors. In fact, statistics show that half the people who have heart attack, 50%, have normal cholesterol. Okay? But if someone has had a heart attack and he has high cholesterol, it needs to be treated. So it is implicated in the blockage of arteries that supplies blood to the heart muscle. Now, what we don't realize is blockage can occur in any artery. In fact, it occurs all over the body simply because the vessels to the arms and the leg are very big. A little bit of blockage doesn't make much difference, so we don't have weakness in the arms and the legs. But when it comes to smaller organs, you might have problems. One is particularly in the males. If you have very high cholesterol and if you have diabetes in addition to that, you are going to have many problems. You will have problems in the eye, the kidney, the heart, and also something that is not talked about very much is you will have erectile dysfunction. In other words, your erection will not be that good, or you may not have an erection at all. Okay. Now, diabetes adds to a high cholesterol problem. In fact, it makes, if you are a diabetic and you have high cholesterol, the complications from high cholesterol is more because of the diabetes. We talked about gallbladder stones earlier. High cholesterol doesn't always cause gallbladder stones, but the chances are higher. Okay. Now that we know these are the things, we would like to know, why does the cholesterol go up? When we were young, we had normal cholesterol levels. No matter what we eat, what is the lifestyle, we sleep late, whatever, the cholesterol seems to be okay. But as we get older, it seems to go up. What are the reasons? Now, all our organs begin to age, and therefore efficiency starts coming down. It's one of the first areas is our lungs. We find that we can't breathe as deeply as when we were young. Our muscles get are not that strong anymore. We the strength in the muscles goes down, and the same thing happens is going on in all the other organs. That includes the liver. So the liver efficiency goes down, and therefore breakdown of cholesterol in the liver is a little less, and therefore this contributes to a higher cholesterol level. Now, as we get older, our digestive system also is a little less efficient. Our digestion is less complete. When digestion is not that good, you suffer from some level of constipation. Now, when old people have constipation, normally what we do is give them some banana, fruits, and all that. And if you ask them, many of them, they are not helped by taking more fruit, because in elderly people the major cause of constipation is poor digestion. What we need to give them is some enzymes to digest their food better, and that will automatically improve elimination. You see, when we do not eliminate our bowels very well, there is a problem. What problem? Now, the bile is secreted into the intestines. Bile has got a lot of waste matter, including extra cholesterol. This must be cleared from the system within a short period of time. If you have constipation, it stays in the digestive system. A fair amount of this, not all, a fair amount, is reabsorbed into the system. It's like throwing rubbish out and then bringing back some of the rubbish back into the body. Now the body has to break down the extra cholesterol plus whatever is being reabsorbed from the digestive system because it is not moving well. You see the the load that is added to a body that is already not that efficient. So eliminating your bowels is very important. I cannot stress more than this. You must make sure that you move well. Okay. Now, some people do not have much fiber in their food that they eat. Now, when you take foods that have high fiber, by the way, all foods have fiber, including meat, but we want a reasonable amount. It is estimated that we need about 25 grams at least in our diet. Now, you can easily get that if you eat normal amounts of vegetable. Vegetable has got high fiber. Fruits too have high fiber, but vegetables have higher fiber. Now, please chew your vegetables well so that the fiber is broken down. Fiber does not easily doesn't get digested. It goes through the stomach and the small intestine, and in the large intestine, it serves as food for our friendly bacteria there. So how is it involved in cholesterol? Fiber can trap cholesterol. So most of us in our diet, we have high cholesterol. In addition, the bile is coming out into the intestines. Now, to trap that and to bring it out, fiber helps a lot. So it will be good if you take a little extra fiber in your diet. Okay. Now, in helping to burn up or use up cholesterol, we need some physical activity. As I mentioned earlier, the burning up or the using up of cholesterol doesn't come from energies, energy source cholesterol. Cholesterol doesn't produce energy for exercise. But during physical activity, our thyroid hormone levels go up. It doesn't go up immediately. Those of you who may have not exercised for a while, when you start exercising, it doesn't go up that easily. It may take about 2 weeks. It might take even a month. In some very sluggish, obese people, it might take at least up to about 2 to 3 months. How do you know it's beginning to work? Blood tests will show. But physically speaking, those who don't sweat easily, you start exercising, not much. You got to exercise 10, 15 minutes to sweat a little bit. You keep doing it, find that in a month's time, you begin to sweat faster. Now, that is one sign that your thyroid activity is picking up. Okay. So, inadequate physical activity. As we get older, we are busy, no time for exercise or games. So, what happens is that contributes to a higher cholesterol level. And of course, the second last, stress. Now, stress, don't get upset about stress. Stress is good for everyone. Stress helps us to function more efficiently, to function more urgently, makes our thinking very sharp. During stress, we think very quickly. Okay. The problem with stress is when you have too much of it and too long. When your stress levels are stretched over a long period of time, there are certain hormones that are released in the body that will neutralize the thyroid hormone, not to say neutralize, block some of the actions of the thyroid hormone, and that includes putting on weight. Now, these stress hormones will create a hunger, a need for food, and you tend to overeat. You will not overeat during the period of stress, but later when you go home, when you're a bit relaxed, these hormones will continue to work, and you find that you feel hungry at night. That means there is some level of stress. So this again contributes to high cholesterol. Be aware of this. You may not be able to get rid of all stress, but if you're aware, you can know exactly how to modify your stress levels. Of course, the last one is a challenge for all Malaysians: unbalanced diet. A diet which is high in fat, high in fried food, of course, carries more cholesterol. Now, one bit of info here: when you take any meat, try to stick to meat that are in sliced form. Don't take chunky meat. Okay, why? Because when you have sliced meat, During the cooking process, a lot of the fat can come out. What remains is the protein. But if you have meat that's very chunky, a lot of the fat doesn't come out. It's retained in the meat. Now, very chunky meat is difficult to cook. So what do? They add more oil and spices to cook it. So you not only have fat in the meat, in the chunky meat, your oil that you are adding adds to the fat. Okay? You look at the Japanese style, you see. Most of the time they take meat, but they are very slim and very healthy. Overall, cholesterol levels in Japan is on the lower side. Now, one of the reason, not all the reason, one of the reason is I think because they take only sliced meat. So when they cook, most of the fat comes out and they get more protein rather than fat. Okay. Now that you know this, you can actually plan something to reduce your cholesterol. And I'll just summarize it here. Exercise. If you're already a person who has a lot of physical activity, then that is enough. But if you don't, then you have to do some exercise. Some people say, "Oh, I'm a housewife. I'm on my feet the whole day." Do I do have to do exercise? I've done some studies, and they find that housewives work a lot. It's a tough job. It is one of the few jobs where you don't have EPF. You have to work the whole day. You're on call 24 hours. But they find that the number of calories you burn is not that high. So what happens is you have to do some planned physical activity. Exercise is basically planned physical activity. This will help with the control of cholesterol for most people, not for all. Now, you have to also alter your diet. Now, when I say alter, I mean change the type of food that you eat. Okay. First thing, this is not stressed upon because most people will not follow it. If you want to reduce cholesterol, they find that you can actually eat whatever you want, provided you reduce the volume. Now, that is difficult for Malaysians to follow. We we all overeat. We are used to overeating. Anything less is not satisfying. So you have to alter your diet. You will have to use more vegetables. So you eat more, but then you do not have that much fat. Use less oil. You don't have to be oil free, but use less oil and use oil that is fresh and don't reuse cooked oil. Some people fry some things and then they keep on frying the same thing in that same oil. You shouldn't reuse oil. So when you go out, you're not sure what kind of oil has been used for frying. I mean, outside, after frying, the oil is reused very often. So when you're eating outside, make sure you have less fried food. Don't take so much fried food when you're out. Okay. And of course, I was explaining about stress. When I say reduce stress, reduce excess stress. That's very important. As I said, to function and to be more productive, you need stress. You don't have to try and get stress to function better. I think all of us get enough stress from the circumstances that we function. Okay. Now, what else will help? It has been found that from the diet, this is what we get. We get more antioxidants and minerals which have a very specific effect on cholesterol. Let me explain this. Now, when we have a lot of stress, we produce what is free radicals. The body reacts by increasing production of certain enzymes to cushion the effect of free radicals. When free radicals are excessive, our organs grow older because there is damage. Okay, so the enzymes in the body will cushion that. But in modern lifestyles, the amount of enzymes produced are not enough. The second line of defense is the body produces more cholesterol to cushion the free radical effect. Now, cholesterol is like a mopper. It mops up a lot of this damage. So, the more damage there is to mop up from the cells, the more cholesterol is produced. And one way of helping the body is to consume more antioxidants. So, if you take in adequate antioxidants, you will find that the body will respond by producing less cholesterol and slower the aging process. Now, I mentioned about 50,000 different enzymes in the body. All those enzyme systems require minerals to work. We require something like 60 plus minerals for the enzyme systems to work efficiently. Can the enzymes function without minerals? Yes, it can. But the efficiency will be far less. Minerals help in accelerating the enzyme functions. Okay, so when I say minerals, we are not just talking about uh, calcium or magnesium. We are talking about even the micro minerals, the smaller ones, chromium, manganese, and so on. Now, that supply is getting low because of our farming practice. By the way, the plants and the animals cannot get cannot synthesize minerals. Plants can synthesize vitamins, fats, antioxidants, enzymes, but minerals must come from the soil. So if the vegetable or fruit is grown in a soil that is depleted, how is it depleted? Repeatedly farming that soil, then whatever grows will not have adequate minerals. And it has been found that the modern diet is very low in microminerals. Okay. Now, another area is protein. We need good protein. Now, many of us Malaysians don't lack protein. In fact, we over consume protein. We take a lot of meat, but a lot of the protein that comes from the kind of preparation that's available in Malaysia, Singapore, it's not useful to the body. We fry the meat too much, we boil it too much, and so what happens is the protein that we consume is broken down and the body cannot use all of it. Okay, it's not that all is lost, but this adds on to the load on the body. The body has to work extra to get rid of this extra unusable protein. So we need to focus on clean, uh, usable protein. And of course, this is something that we have talked about, better elimination. And I think this is an area that everybody should pay attention. Just a bit of information here. They have found that those who have breast cancer, 100% of the cases have constipation. They do not have adequate elimination. Is that connected? Many health experts think so. For example, the hormones that are broken down also comes out in the bile. Now, if these broken down hormones are still in your digestive system too long, some of it gets reabsorbed, and some of this reabsorbed broken down hormones get concentrated in fatty tissue. Which area? Mainly the ears. This can upset some of the chemicals reactions that are going on and cause an increase in cell division of the cell breast cells, and that's how we get cancer. Okay, so elimination, very big topic but very important. Now, how do we get all this? Now, this is where I'd like to introduce VeMMA products. Remember this: antioxidants, microminerals, clean protein, and you need elimination. This four. We'll come back to this again and again when I talk about the products. Now, VeMMA has the products that you see on the screen. Now, if you look at it carefully, it looks like a lot of products, but actually we have a very basic formula. Whether it is here or in this area or in this can, what we have is vitamins A, B, C, D, and E. Each serving gives you a full day supply. Okay, that aside, all of them have micro minerals, up to 65 micro minerals that are plant based, and also antioxidants in each serving that is adequate to cover your daily requirement. So even if you can choose any product and you will get your vitamins, your minerals, and your antioxidants. Now, for this purpose, the cholesterol part, I think the important part is antioxidants and microminerals. Now, what else is different here? Now, between this big bottle and the small bottle here is the same, except that the smaller bottle carries a single serving. So you can take it and just discard the bottle, the small bottle. This is more convenient when you're traveling. The bigger bottle, you can use it at home. A bigger bottle, you need to open and pour it out. And the smaller bottle is more convenient when if you're a person who's moving around very often. Now, some young people would like this presented in a more attractive form. So what has happened is we have created this product called Verve in a can, the same vitamins, microminerals, antioxidants, but because it is for young people, we have carbonated it. So there's a nice and gassy and fizzy. And also we have added a few ingredients which will give you extra energy. We have added caffeine, which is caffeine equivalent to one small cup of coffee, of course, without the milk or the sugar, just the caffeine. We have also added other ingredients to boost your energy. One is taurine, which is 1000 milligrams. One of the few substances that can actually go straight from the blood circulation into the brain and support nerve energy. Okay, this is excellent to give yourself not just energy but your basic nutrition while you're getting something for energy. Now here actually we have three different products. As you can see, there is a smaller can here, there is the bigger one which is silver color, and the blue color. Now this silver colored and the blue color has vitamins, minerals, antioxidants, and also 20 grams of clean hydrolyzed protein in each container. This is in concentrated form. You need to add water to consume it. So when you take this, you will get enough protein. What's the difference between the silver and the blue? The silver, we have added some herbal extracts to improve your thyroid function, the rate at which you burn energy. That also will help with the lowering of cholesterol. What about the blue one? The blue one, the formulation is such to help you relax. I mentioned earlier about stress. The hormones that are released during stress start working on you at night. If you take this product, the combination of herbs there will help you to relax, will help you to lower those hormones while giving you vitamins, minerals, antioxidants, and 20 grams of protein. Okay. Now, this small one here, we talked about detoxification or rather elimination. Okay. If after doing all that you still have problems, you could take this. Now, this one taken in the morning, you will get results within half an hour. Okay. I suggest that you start, or you want to try it out, you try it out during a weekend. We don't want you to get something while you're on the way to work. So try it out during the weekend for this. So just to remind you, supply of antioxidants, minerals, clean protein, and better elimination to help reduce your cholesterol levels if they are high. These products are ideal. I would urge you to talk to whoever invited you for this talk, or if you're already familiar with the company, to go through some of the ingredients in the product. Choose the product you want to take. Some of you may want to buy a little bit of all the products. 1 or 2 days you take this, while traveling you take that, once in a while you are in a good mood to do something, you take this, and if you feel that your stomach is not doing that well, you want to eliminate, you take that. So you could sort of vary it. Okay. um, I think I will stop here, and because we have already some questions coming in, we'll be glad to answer those questions. Yes, Michelle. Yeah, yeah.
Hi, thank you, Doc, for your sharing on cholesterol. We already have question coming in from Andy. Andy need to know something else from cholesterol, but he need to know what is the food that bodybuilder prefer.
Ah.
So, Doc, what is your idea on it?
Okay. Now, bodybuilders are people who build muscles by doing resistance exercise. Most of the time, resistance exercise is through lifting weights. Because now there are so many gyms in town, and it's quite easily available, this kind of thing. Okay. Now, bodybuilders require extra protein. They need to eat a very balanced diet. Now, if they go into bodybuilding seriously, the protein requirement is much higher. So, I would urge them to consider this product here, body. Now, by taking both the body, that is the silver colored one and the blue colored one, you will have 40 grams of protein from this two. Now, in your diet, as a bodybuilder, you have a good appetite. You will be eating more. You will easily get another 60 grams, so which will add up to something like almost 100 grams. That's pretty high for normal people, but for bodybuilders, that is the basic. So I would suggest that you take these two products. Now, this will not only give you the protein, but also your vitamins, your antioxidants. Remember, when you do bodybuilding or excessive exercise, a lot of exercise, you actually produce more free radicals, and you need to take antioxidants, and this will add to that. Yes, Misha.
Okay, we do receive another question. How wolf can prevent cholesterol, especially for young people and also elderly people?
Uh-huh.
Wolf
Okay.
about wolf regarding to cholesterol.
How will WRF help reduce cholesterol? Now, reducing cholesterol is a multifaceted thing. You can't do one thing to reduce cholesterol. The first would be to start with your diet. That is the most important. The second would be to exercise. Number three is to look at the supplements that you need to take. Now that's where WRF fits in. WRF has very high antioxidants. It has all the micro minerals that are present in the other VeMMA products. That's how it supports the nutrition part of it in the body to help lower the cholesterol. Now, the energy part will also help in the exercise, which is an indirect contribution to reducing cholesterol. So please do not promote WRF as something that will reduce cholesterol. No, reducing cholesterol, there are several things you need to do. The third option is the supplementation. And if you're a young person, WRF is more fun to take.
So another question for you. I think it's a general question. Okay. Does the caffeine can cause miscarriage?
Um, Caffeine.
Yep.
Now, if you look at our eating habits here, almost everyone drinks about 2, maybe 3 cups of coffee or tea every day. Now, caffeine is found in coffee and tea. Uh, Coffee has twice the amount of caffeine as tea for the same volume. Now, this is not the only food that has got caffeine. Do you eat chocolates? You have caffeine there. Drink Coca Cola? You have caffeine there. So, if you look at the average Malaysian diet, we take in caffeine from various sources. Okay. Now, the amount of caffeine found in one can of Verve is equivalent to a small cup of coffee. which is about 70 to 75 milligrams of caffeine, which is not much. Now, having said that, there is a small group of people who are sensitive to caffeine in any form. I had a friend who, one cup of coffee, he will start getting palpitations. The heart rate goes fast, and he doesn't take coffee, but sometimes he takes some food which has got high caffeine. And at one time, I know he had to be admitted because the heart rate was too fast. So very rare. I have not come across very many people in all my years of practice. Maybe I've seen 3 people like that. But when it comes to miscarriage, no, caffeine doesn't cause miscarriage. Of course, when you are pregnant, there are many other unknown factors. You need to look at that. Okay.
Okay, Doc, I have another question for you.
Mm.
Is regarding on product. If let's say a product package is written there low cholesterol, does that mean it's low in fat as well?
Okay. Now, the the labeling is another big topic. Maybe we need to talk about because there's so much deceptive labeling. Some labels say no cholesterol, or low cholesterol. Some have no cholesterol. Now, does that mean they have no cholesterol? Yeah. Is it healthy? May not be healthy. If you ask me, a packet of cigarettes, no cholesterol. Is that healthy? There are many other things there that are not healthy. So, what we need to look for that is associated with cholesterol. Two things. One, calories. Are the calories very high? Number one. Number two, is there a lot of sugar? Now, sugar, when taken in excess, can be converted by the body into fat, which can be used to synthesize cholesterol. So, in fact, if you want to reduce cholesterol in your body, you have to cut down sugar. Now, so if a product is low cholesterol, that may be true. You need to look beyond that to see whether the calorie level is high or there is a lot of sugar. Sometimes the sugar is not labeled. They will say cane sugar or sorbitol or in some other chemical form. Okay? Anything with OL, sorbitol or glycerol, they are all related to sugar. So you need to be a little careful.
Okay, Doc, I would like to ask also, how much cholesterol is too much? Is there any indication on that?
Now, if you want to measure the cholesterol you're eating, you have to memorize a lot of figures, and sometimes that's not easy. For example, an egg is considered to have about 200 milligrams of cholesterol. Now, there again, it depends whether it's kampong egg or some other egg. It can vary. Every chicken is not the same. Egg is not a factory produced item. Okay, so but so how do you keep an eye on cholesterol? Now, if you look at the identify the foods that have cholesterol, okay, that is basically meat, fried food, and eggs. So, how much do you take? Take what you need, not more. In fact, all of us eat more than what we need. Why we can be, if you want to really cut and not worry about cholesterol, because if there is a shortfall, then the body produces it because the body produces about 70 to 80% anyway. Now, is there any way to be sure that we are not consuming excess cholesterol? Not really. The only very broad sign would be putting on weight. Usually, when you have a diet and you're consuming excess cholesterol, you are also consuming excess calories. So, if your weight is going up, you are probably consuming excess calories and cholesterol.
Okay, so Doc, I would like to ask, if so, what are the symptoms of a person who is high in cholesterol? Is there any symptom?
Someone who has high cholesterol, can he physically know that something is going wrong? Now, unfortunately, no. um, they say high blood pressure is a silent killer because most people who have high blood pressure have no symptoms. With cholesterol, it's even worse. Okay, because there is absolutely no symptom. Now, however, just going back to my practice, um, if you have a very oily skin, okay, you need to check your cholesterol. Huh? Don't go for cleanser only. Check your blood also. If you have a very oily skin, um, if you have excess body weight, check your cholesterol. You may still have normal cholesterol. A lot of fat people have normal cholesterol, but the chances of having higher cholesterol among obese people is higher. Okay, another one which is may not correlate very well. There, some people have some deposits in their upper eyelid. It's a small bulge-like thing, and it looks like something is deposited. Now, that one signal, and it doesn't happen to everybody, not even many people, only some people, it could signal that you have high cholesterol. Yeah, so the only sure way of knowing is to go for a blood test.
Okay, Doc, we do receive another question from Angel. Angel asking, I think she is kind of sensitive to coffee. Okay, she feel hot and heart pumping very fast after drinking coffee. So is it because too much caffeine inside the coffee?
Now, when we drink coffee nowadays, many people take three in one. I'll talk about both. Three in one is good for an emergency, but do not drink three in one on a regular basis. There's still too much sugar, even though they have reduced it. And to have all the three mixed and quickly dissolve in water, you need to add a lot of chemicals. So if you drink three in one on a regular basis, you are actually pumping in quite a bit of chemicals into your body, which contributes to free radical. Now, regular coffee is much safer, much better. In fact, the safest coffee is local brew coffee. Okay. Now, having said that, when I take coffee and tea, I have palpitation. Now, we talked about caffeine, but I also would like to warn you, if there is a lot of sugar in the coffee is very sweet, that also can give palpitation. Okay, the milk not so much, it's the sugar. Okay, of course the number one thing is the caffeine, number two is the sugar, and for some people it may be the combination. Okay, so it'll be good if you can get lighter coffee. Now that may be difficult unless they if they are brewing it, or order one cup of coffee and share between two people, add some hot water, okay, and cut down the sugar there. Um, you may want to try kopi o without sugar, just one round, to see whether caffeine alone is causing your palpitation. Of course, you can't drink kopi o without sugar, so you probably need half a cup just for the sake of it. Um, one good way of trying is probably latte. Latte, they don't put in sugar, they put cream, I think. Some restaurants call it flat white. They don't put sugar. It's just coffee and cream. Very nice taste. So if you have palpitation with latte, which is without sugar, then you're sure that it's only the caffeine. Okay, that way you can make out. Uh, and of course, caffeine, for some people, lower caffeine doesn't cause problem. So if caffeine is the problem, the next step would be to try out a diluted coffee. So there are a couple of steps to find out exactly which is causing the problem.
Okay, Doc, another question for you. Does smoking affect blood cholesterol level? Smoking?
Now, our body is very complicated. When we put some stress on our body, when I say stress, I'm talking about chemical stress, food stress, okay? Our body has a way of dealing with that. Some people deal with it very well, some people can't deal with it. Smoking increases free radical activity, so it should increase your cholesterol. But if the person has a very efficient liver, he may be able to control the cholesterol. So quite a number of smokers I've seen have normal cholesterol. But does it increase the load on the body to maintain the cholesterol? Yes, it does, because that's an extra load on the body. The nicotine that goes in, and we only know about nicotine, we don't talk about the many other harmful chemicals that are inhaled into the body along with the cigarette. All this adds to the burden.
Okay, Doc, I think this is the last question for tonight's session. Does the risk of heart disease due to the increase of blood cholesterol with age?
Okay, now the heart disease, we are talking about coronary artery disease. There is blockage on the wall. Now, when they scrape the blockage and do an analysis, they find all kinds of stuff dumped there like rubbish. There is calcium, there are deposits like fibrin fiber from the blood, white blood cells, platelets, and of course a very high amount of cholesterol. So which is the one that is causing? You will be surprised, medical science hasn't really worked it out, but because of a lot of cholesterol there, the thinking is excess cholesterol can contribute to blockages. They have also found that if you reduce your cholesterol, it helps in reducing the blockages. Not all the time, but a good number of times. So the two put together, we would go one step further and say we must take steps to reduce high cholesterol if a patient who has heart problem has high cholesterol. Okay, so that can be done by diet, exercise, medication, and so on. Now the next question is along that line: normal person, high cholesterol, what should you do? Should you take medicine or only prevention? I would say if you are detected to have high cholesterol, no heart problem, nothing, go on a very strict diet, go on an exercise program. It may take up to 6 months for the body to start reducing your cholesterol. Don't be too much of in a hurry, okay? Now, if after 6 months you find that you followed the diet and the restrictions, exercise, say about 80% lah. Nobody can follow 100%, 80%, and there is no change, then you may need some medication. Now, the moment when I say medication, everybody says, okay, I take medicine and start eating what I want. No. If you do not follow your diet carefully, if you do not exercise, the amount of medication you need is higher. If you do all that, you need very little medicine. Now, does that make a difference? Yes. Medicines for high blood pressure, diabetes, not much side effect. But medicines for cholesterol have a lot of side effects. So you don't want to take the medicine if you can. If you have to, you take as low dose as possible.
Okay, first of all, I would like to thank you, Dr. Ibrahim, for the sharing for tonight. I would like to remind that our next session is on Thursday, every alternate Thursday, with other interesting topic. So please stay tuned on our VeMMA Asia corporate page, Facebook, or email blast on the further notice. Lastly, I would like to thank you everyone who joined us tonight, and good night.
How to lower your triglycerides with diet. Does your doctor require that you adjust your lifestyle and learn how to lower your triglycerides with diet? If so, you have a challenge that is by no means insurmountable. It's ideal to control your cholesterol as a preventive measure. However, when your doctor tells you to do it not as an option but as a necessity, then you should definitely make adjustments accordingly. It is hard to change habits that have been forged over a lifetime, but it is possible. The changes may be minor and not as hard as you think. Triglycerides are fats in our blood brought there by the food we eat. Elevated triglyceride levels in the body increase the risk of heart disease and stroke, which is why they must be controlled. Here's how to lower your triglycerides with diet. 1. Watch your intake of sugars, alcohol, carbohydrates, starchy foods, and refined grains, as these contribute significantly to high levels of triglycerides. Most of us think that since triglycerides are fat, then lowering our fat intake will lower triglycerides. But the main trigger of triglyceride levels is sugar. Simple sugars and natural sugars are both culprits. Simple sugars are commonly found in foods such as table sugar, candies, syrups, jams, jellies, desserts, soda, juice, etc. Natural sugars are in honey, molasses, canned fruits and heavy syrup, sweet fruit, etc. The body converts refined carbohydrates, starchy foods, potatoes and yams, etc., and refined grains, white bread, pasta, rice, etc., to sugar, which must be monitored also. Alcohol contains a high quantity of sugar and must be cut back drastically or eliminated from the diet altogether. 2. Choose the kind of fat you eat and eliminate trans fats from your diet. Eat fish high in omega-3 at least 3 times a week. Salmon, mackerel, and other cold-water fish are natural sources of good cholesterol and can help to significantly lower your triglycerides. If you must use fat for cooking, switch to monounsaturated fats, such as olive, peanut, and canola oils. Stay away from fried foods and other foods high in trans fats, especially junk food, commercial baked goods, etc. 3. Reduce your calories and intake. The body converts excess calories into triglycerides, which are then stored as fat. When you have more calories in your body than you use, it will increase your triglyceride level as well. 4. Choose what you eat. Eat more of high-fiber foods, vegetables, high-protein foods, and healthy carbohydrates. 5. Space your meals evenly. Do not skip meals and avoid too much snacking. The goal is to keep your blood sugar under control. Going hungry will lower your blood sugar levels and make you tend to overcompensate by eating too much at the next meal or by making you crave for sweets. Eating evenly spaced meals will keep you less inclined to binge on snacks and unhealthy foods. Excessive snacking, especially at night, will raise your weight and trigger a rise in triglyceride levels. 6. Exercise regularly and lose weight. Try to keep a regular regimen of at least 30 minutes daily physical activity that makes you sweat. Regular exercise helps keep good cholesterol up and bad cholesterol and triglycerides down. Lowering your weight to the desired level for your age and body type can also help lower triglycerides. Although medications for lowering triglycerides are available, they do have serious side effects. For this reason, the American Heart Association recommends medications be taken only as a last resort after all other natural means of lowering triglycerides have been done. If you need to take it, however, be careful to take it as prescribed by your doctor. Keep in mind that medication helps, but lifestyle habits make a significant impact on your triglyceride levels too. This is why you must do your best to cut your risk of stroke and cardiac attack by keeping healthy lifestyle habits. Follow these steps on how to lower your triglyceride levels with diet.